We have all experienced that split-second moment of absolute panic in the bathroom. You take a quick glance before flushing, and the liquid staring back at you is a completely bizarre, unexpected shade. Instantly, your mind starts racing. Is my body failing? Am I secretly sick? Do I need to rush to the emergency room right now? As a medical expert, analyzing little plastic sample cups is just a standard part of my workday. And to be honest, 3 specific things constantly blow my mind. First, the incredible spectrum of vivid colors our internal systems can produce. Second, the massive amount of hidden medical intel those colors provide about our vital organs. And third, the terrifying reality that most folks have absolutely zero clue what their bodies are desperately trying to tell them. That changes right now. Today, I am going to turn you into a master decoder of your own daily health. We are going to map out the perfectly safe zones, the undeniable emergency signals, and a few downright weird shades that will leave you absolutely speechless. By the end of this video, you will know exactly when you can safely relax and when you need to dial your doctor immediately. But before we tackle those terrifying warning signs, you need to hear a fundamental, jaw-dropping truth. What you flush away every day is actually your blood. Yes, you heard that right. It is simply a highly purified version of your own bloodstream. Picture your kidneys as the ultimate state-of-the-art biological water treatment plant. Operating 24/7, they vigorously scrub around 180 liters of liquid directly from your cardiovascular system every single day. So, if urine is essentially filtered blood, what exactly makes its way into the toilet bowl? Once your highly efficient kidneys have pulled all the necessary nutrients and water back into your system, they discard the leftovers. This leftover liquid cocktail consists of bodily waste, excess electrolytes, and a very specific, fascinating natural dye known as urochrome. Urochrome is simply the biological byproduct of your old, worn-out red blood cells naturally breaking down. A completely normal and healthy daily process. Here is the golden rule of hydration that you must remember. Your body manufactures roughly the exact same amount of this yellow urochrome pigment every single day. The volume of that pigment remains remarkably constant. The only variable that actually shifts is the amount of water you consume to dilute it. Think of it like adding a single drop of yellow food coloring to a glass. If you put that drop into a tiny shot glass of water, the liquid will look dark, heavy, and intense. That is your internal system running dry. If your urine looks like dark apple juice, you are noticeably dehydrated. On the flip side, if you drop that same single drop of yellow dye into a massive gallon jug, the liquid will look practically transparent. If your bowl looks like pure tap water, you are actually overdoing your fluids and flushing out vital electrolytes. As Dr. Victor Halston, I constantly see patients who wonder why they feel chronically sluggish. Often, it is the classic American lifestyle, surviving entirely on a daily string of drive-through iced coffees and energy drinks, while actively avoiding plain water. Your baseline, the perfectly healthy standard you should always aim for, is a pale, translucent straw color. Once you establish that healthy baseline, you can instantly spot when things go terribly wrong. And speaking of things going wrong, that brings us to the ultimate red flag. Now, we move on to a color that requires your absolute undivided attention. In the medical world, we have a very simple saying. Blood is meant to stay safely inside the pipes. If you are seeing it in your toilet bowl, it means that something, somewhere inside your biological system, is actively leaking. Let me share a real story about a patient. We will call him Robert, a hardworking contractor in his mid-50s from Ohio. A while back, Robert came into my clinic because he had noticed his urine was tinged with a distinct pink color. The terrifying part is he almost did not even book the appointment. He only showed up because his wife practically forced him to come see me. Robert felt completely fine. He had absolutely zero pain, no sudden weight loss, and no dramatic symptoms whatsoever. He just assumed it was probably something weird he ate and figured it would just vanish on its own. But it did not. As Dr. Victor Halston, I knew we could not just brush this off, so I ordered some thorough medical investigations. It turned out that Robert had an early-stage bladder tumor. Because we caught it so early and treated it aggressively, he is doing incredibly well today. However, if he had ignored that subtle pink warning sign for another 6 months simply because he felt fine, his story could have ended in a complete tragedy. Now, please listen carefully because this is the most important takeaway of this entire video. Finding blood in your urine does not automatically mean you have cancer. In fact, the majority of the time it is something entirely different. It could easily be a severe infection, painfully sharp kidney stones, an enlarged prostate, or sometimes even the result of intensely vigorous exercise. But here is my unbreakable rule for you. If you ever see red or pink urine, you book a medical appointment immediately. Not next week, not in 3 months, and absolutely no wait-and-see approaches. You book it right now. This is not about being overly dramatic. This is simply about being smart and protecting your life. Now let us talk about a scenario that might seem like a fitness achievement at first glance, but can actually turn into a complete medical nightmare. Imagine this. You decide it is finally time to get into the absolute best shape of your life. This brings us to a patient of mine, let us call him Jake from California. Jake had not worked out in years, but abruptly decided to sign up for an incredibly intense, grueling mud run obstacle race on a whim. He pushed his body to the absolute maximum limit. Naturally, he felt incredibly sore afterward, but then he went to the bathroom and noticed his urine looked exactly like dark brown cola. Initially, Jake brushed it off, assuming he simply had not consumed enough water during his exhausting workout. And while it is absolutely true that severe dehydration can cause your liquid waste to become exceptionally dark, extreme physical exertion, especially a massive sudden jump in intensity from your normal daily routine, can trigger something far more sinister. It can lead to a very dangerous, albeit lesser-known condition called rhabdomyolysis. As Dr. Victor Halston, I have to warn you about how serious this truly is. Rhabdomyolysis occurs when your overworked, stressed muscle cells literally break open and dump a toxic muscle pigment called myoglobin directly into your bloodstream, which eventually gives your urine that frightening, dark cola appearance. While this condition is not an everyday occurrence, it certainly is not a rare myth in the fitness world either. So, here is your non-negotiable rule. If you notice this deeply dark brown color after strenuous activity, immediately start drinking plenty of water. However, if the color does not rapidly improve, or if you begin to feel deeply unwell, severely nauseated, excessively weak, or abnormally sore, you must get medical help right away. Never try to play a guessing game with your vital organs. If you are ever unsure whether the liquid in the bowl is dark brown or actually a dark red, refer back to our previous rule. Get an appointment and have a professional check it immediately. Now let us move away from the dramatic, vibrant colors and talk about the more subtle, silent signals your body sends. Sometimes the issue is not exactly the color, but rather the texture and clarity of the liquid. Let us start with cloudy urine. If you glance down and notice the water looks murky or cloudy, but you feel absolutely fine otherwise, do not panic right away. Often, this simply means your urine is highly concentrated or there is a minor bit of harmless sediment passing through. The best approach here is to hydrate thoroughly and reassess the situation the next day. However, the context changes entirely if that cloudy appearance is accompanied by other symptoms. If you have cloudy urine combined with a burning or stinging sensation, a sudden, urgent need to go far more frequently than usual, or a dull ache in your lower abdomen, that could very well indicate a urinary tract infection, or UTI. As Dr. Victor Halston, I need to specifically address the men watching this. While UTIs are quite common in women, they are far less frequent in men. If you are a male experiencing these symptoms, you absolutely must not ignore them. This is what we call same-day doctor territory. So the simple rule is, cloudy on its own? Hydrate and check tomorrow. Cloudy with painful symptoms? Get checked immediately. Next up is foamy urine. I am not talking about a slight froth. I mean when it looks like you have just peed into a bowl full of dishwashing liquid. A one-off froth, especially right after you wake up, is often just due to the sheer physical force of a strong stream hitting the water. But if you notice persistent, thick foam lasting over several days, you need to pay attention. This persistent foam strongly suggests that protein is leaking from your kidneys into your urine. Just like we discussed earlier, blood is supposed to stay in the pipes, and protein is supposed to stay there too. When protein leaks out, it often points to significant kidney strain, wear and tear, or even an underlying chronic kidney issue. It is not a rush to the emergency room at midnight type of emergency, but it is certainly not something to brush off. The solution is straightforward. Provide your doctor with a first morning sample, the very first pee of the day, and they can easily test it for you. Now, let us explore some of the more bizarre and unusual shades that can show up in the toilet bowl. Over the years, I have seen some truly unexpected colors that naturally cause a high level of alarm for the patient. However, the good news is that most of the time, these dramatic hues are completely harmless. Let us start with completely orange urine. I vividly remember a patient, Emily from New York, who rushed into my clinic in a total panic with a sample that looked exactly like this. Honestly, I felt like a brilliant medical detective when I simply looked at her and asked, "Have you been eating a lot of orange-colored foods lately?" It turned out she had been aggressively meal prepping carrots and sweet potatoes all week. That was the entire explanation. Certain daily vitamins or simple dehydration can also create this vibrant orange hue. So, whenever you see a new color, always ask yourself, have I put anything different into my body recently? And then there is blue or green urine. Seeing this can be incredibly shocking, but there is usually a very straightforward reason. A very common medication prescribed across the United States, known as amitriptyline, is famous for causing this effect. Certain medical dyes used during procedures, artificial food colorings, or very rare infections can also be the culprit. It certainly looks highly dramatic, but it is rarely a reason to panic. As you have seen today, your biological system is an absolute master at leaving you tiny continuous clues about your overall internal health. The color of the liquid in your toilet bowl is just one piece of that massive medical puzzle. But it certainly is not the only one. Just like the warning signs we discussed today, your fingernails are another major indicator of what is happening deep inside your organs. While some spots, lines, or ridges on your nails are totally harmless, a few specific changes can be deadly serious. I have put together a complete, detailed breakdown of exactly what your hands are desperately trying to warn you about. Click on this video right here on the screen to discover the shocking truth. I am Dr. Victor Halston. Thank you so much for watching, and I will see you over in that next video.